I'm Jeff Lancet. I'm the chair of the Department of Malignant Hematology at Moffitt Cancer Center. And we are here at the annual American Society of Hematology Symposium and Conference in New Orleans. And I am joined by Dr. Eric Padron, who is the scientific director of our Department of Malignant Hematology. Eric is a translational scientist and clinical investigator. And Eric, why don't you tell us a little bit about some of the work that you're doing in your lab as it relates to myeloid malignancies?
Yeah, so I generally put our laboratory work in two categories. One of the categories is trying to understand the reason that patients who are diagnosed with what we call chronic leukemias end up progressing to more aggressive disease. And that's because when we see them, oftentimes they have no symptoms and they feel fine. And so we want to find what are the factors both in the leukemia itself, but environmental factors, stressful factors that could lead to the disease progressing and actually manifesting as something that is, a serious cause of side effects for our patients. The other one that I would say is also important to us is really capitalizing on the great work that our clinical team has done in getting clinical trials for, clinically unmet need leukemias, and using the samples, the patient samples that are derived from those studies to understand why some patients respond, why others don't, and why the disease comes back even after the treatment works for a little while. So I think that those are the two things that we really focus on in the lab.
Eric, your lab has done some amazing work at recapitulating human diseases in mouse models and ultimately gaining an understanding of the mechanisms that drive myeloid malignancies, disease progression. One major area of unmet need in cancer in general, but especially in myeloid cancers, is the p53 mutant myeloid malignancies, MDS and AML. That's an area at Moffitt we've been focused on. Can you talk a little bit about some of the work you've done, in particular an abstract that you've presented at this meeting that focuses on ways to target mutant p53 and how that might be translating into a clinical trial?
Absolutely, and that it's a good example of that second category that I mentioned, where Dr. Salman in our department has led clinical trials in this really horrific type of leukemia that doesn't have any treatments that change it, that were very encouraging, but unfortunately patients relapsed. And so the basis of our study was, can we understand the underlying molecular biology of those patients to really lead to a new therapy that can overcome the resistance that we see. And in our studies, we think that at least in some people, it's because a protein called XPO1 or exportin is upregulated. And it turns out that there are actually clinically available drugs that inhibit it. And so one of the goals of our study is that hopefully that we provide enough evidence so that a clinical trial is done with these new inhibitors of exportin in combination with the drugs that Dr. Salman has already used for myelodysplastic syndrome. So that's one example of how we want to leverage a lot of the stuff we're doing in the clinic to understand more why patients relapse or don't.
Awesome, thanks so much. We look forward to hearing more about this and how it develops.